Chemical peels are taking an actual chemical or a acid, whether it's an alpha hydroxy acid or a beta hydroxy acid, and applying it to the skin to either brighten the skin, tighten the skin, kill bacteria for acne, to soften fine lines and wrinkles. It's just a means of taking a chemical or an actual acid and applying it to a patient's skin to get the results that we're looking for as far as, correcting anything that their skin has been doing that they're not super happy with. So here we have quite a few different versions of that. Everything from skin brightening to going in and helping with acne is a big one, because nobody likes to deal with acne, and it's a much quicker way to correct acne and to kill that bacteria by using a chemical peel. The way we do it here, it's pretty awesome. You come in, lay on the table, get a nice hot towel cleanse, depending on what we're focusing on, which cleanser is what I use. From there, skin analysis, so kind of say, hey, let's talk about what you're not happy with when it comes to your skin, and what an actual chemical peel can do to correct the skin. So together I kind of hand you the mirror and say, come on in, let's look at this and see exactly what's going on. And I can take the peel itself, focus and kind of pinpoint which one I need to be using. And actually I can take some of the chemical peels and use two different types. If I'm trying to focus on one, like let's just say we get that monthly spot that comes in on our skin, but it only comes in once in a while, and everywhere else we want to focus on really glowy skin, I can take just a little bit of like a salicylic acid on the Q-tip and pinpoint that one little spot. So it's pretty nice because we can customize everything here. After doing the skin analysis, you get a little micro polish, so we kick off any dry dead skin cell that needs to go, because the last thing you want is a ton of acid going on to dry dead skin. It's not going to feel great under any circumstances. So we polish the skin off, hot towel after that, and then we really focus on going in and using whichever level or strength of acid that we need to be using that day. Depending on which chemical peel we do, after we neutralize the peel, we may be doing like a brightening powder mask, we may be doing an acne based mask, there may be steamer involved. It just all depends on what your skin needs. And that's the nice thing about it, is you come in, you and I sit down, we discuss what your concerns are, what your skin needs, and together kind of pinpoint what we need to do, and then build your returning appointments from there as to what we can do. And it doesn't have to be the same thing every time you come in. Everybody's skin changes. Thanks Michigan to our wonderful weather changes outside. You can come in and have 2 acne facials done, acne is gone, and then from there let's talk about getting rid of scarring or brightening the skin. So it's never something that you have to do the same thing every time. I will actually pinpoint and correct and do what we need to do to get the results that you're looking for. The most popular is probably our sensitive peel. It's something where actually, even if you came in, let's say 2 weeks prior to an event, there wouldn't be a problem. You would leave here that day doing a sensitive peel and skin is going to feel a little bit tighter. Skin's gonna maybe not so much do the flaky, peely snake shed, but we're kicking off any of those dry dead skin cells in a much gentler way, especially for most people have sensitive skin. We've done a lot to our skin over the years, and your skin kind of has quick reactions. If you're the type of gal who has reactions to even the skin being touched, the sensitive peel itself is a fantastic way to get rid of dry dead skin cells, so everything that I'm using here and everything that you're using at home can actually do its job properly, all the way up to our advanced peel. We have a pretty strong, we have 30% peels, we have corrective peels, we have brightening peels. It's pretty awesome. We do also incorporate derma planing with all the peels. Derma planing is literally me taking a scalpel and very carefully and very guarded, kicking off any dry skin cells that need to come up, any little vellus hairs that need to go. That is done before any of those peels are applied. That way the acid itself has a better gateway to getting into the skin properly. It also gives you that healthy, dewy glow, even immediately after the derma planing, and then you go in and have the peel applied, and man, you can't get better results with that combination. Who should consider a chemical peel? Darn near everybody. I know they sound scary, and I know, we've seen things on TV where gals have had chemical peels done and they look like their face is completely falling off, and that's not the reality of the beast. A chemical peel itself is made and presented for every skin type. I personally love doing acne-based chemical peels. I think they're a fantastic way to kind of get rid of what needs to go, kill the bacteria, introduce new products to the skin. I feel like we kind of get ourselves in a really kind of a rut when it comes to acne, and sometimes we're creating it ourselves. So having like a redo or a fresh start with a chemical peel, and I can't say one is enough, because typically with acne you do have to come in multiple times, kill that acne along the way until it's gone, and then we focus on other things. Everybody can though. If you're, big event coming up, you want your skin to be healthy and fresh and dewy and glowy, and you want your makeup to lay like a dream, absolutely come in. For gentlemen particularly, if they come in and they're having different issues with like razor burn, usually that means we're having some underlying issue as far as, dry dead skin cells that are building up multiple times. So having a gentleman come in for a chemical peel is absolutely something that happens quite often. Even if it's somebody who's coming in and saying, hey, I can see my pores from 10 feet away in a mirror. Like, nobody wants to see that. So coming in, having everything extracted, cleaning out the skin properly, then going in with a chemical peel is the way to go. It's definitely a way to set up your skin properly before any bigger services, whether it's coming in for something like a CO2 laser or, oh my gosh, any of the lasers, to be quite honest. Even my hair removal lasers you could do and set up the skin properly, do a chemical peel before you have that service done. So there's not a whole lot of people that can't benefit from having a chemical peel done. Even your higher Fitzpatrick, your deeper, darker, beautiful chocolate skin, we can still do chemical peels. I have to be a little more precautious, but it's still something that everybody can benefit from. The results, depending on which type of chemical peel we're doing, I can't say forever. It's typically, you got to think of skin, changing itself over, flipping itself over within how old you are. So say you're 35, my skin kind of sheds or forms itself within 35 days. If you're 18, it takes 18 days. So everybody kind of varies that way. So typically, the older we get, the more layers we're seeing, the more unhappy people are with their skin. And that's because their skin's taking a little bit longer to kind of desperately to shed. So it's something where I like to say, 30 days. Come in and see me every 30 days. If it's acne, there's a different setup. We're almost gonna see me about every other week to kill that bacteria. Something that you really kind of want to get under control, especially young women who are dealing with the evils of hormones. Not to say young men aren't, because they are too, but you'll come in a little bit sooner than you would for another, like a corrective peel versus like an acne peel. But typically I say about every 30 days. Not saying that you won't see great results if you only do it 4 times a month or yearly, you're only coming in every quarter. Still will definitely see a difference in your skin. The skin itself will absorb product more readily. It'll be kind of ready for that skincare that you're bringing home. So, but I kind of like to say every 30 days, because after 30 days, you're going to touch your skin and be like, oh, I really need that done again. Typically, scale from 1 to 10, 10 being like, this is the worst thing I've ever done to myself. I don't let a patient get any higher than a 7. We obviously use fans to keep the skin comfortable, cool towels immediately after to keep down, any heat that's in the skin, but it is not unbearable under any circumstances. I have a couple of peels that in particular that, don't feel the greatest, but it's kind of like with this saying, with beauty is pain. So I keep my patients as comfortable as possible. Definitely make sure that fan is going, if not 2 fans, and just making sure that, we're talking through the entire service. I want to make sure that they're as comfortable as possible. Doesn't mean that I can't neutralize a certain area. If one area in particular is super uncomfortable, we just neutralize that area and kind of let everything else continue to do what it needs to do, and then neutralize and cool towel and kind of go from there. So not too bad. It's definitely worth it. It's definitely worth it. They go hand in hand with products at home to make sure that you are getting the longevity out of a peel. Help with any injectables as well. We're brightening the skin. We're making sure that we're getting rid of those dry, dead, icky skin cells, and doc's going in and using an injectable to kind of do what she needs to do to fill where there needs to be filler, to kind of get that tight skin back. They go hand in hand with one another, and there's no saying that you can't have a chemical peel done with me and then walk in and see Dr. T. Mick and have an injection done the exact same day. There's no contraindication to that. So no problem whatsoever to have, you know, a couple things done in one day, which is pretty typical. You know, everybody, time is money, and dang it, you want in and out the door with results, and that's kind of the way to do it.